Hi guys and girls, my name is Dr. Sharfari and today I'm going to talk about PMS. Well, what is this PMS? We have heard about it a lot, If your girl is having mood swings and then, for a few days she's very irritable and she's getting angry, grumpy, anxious and depressed. She's getting so irritable for a few days, then you get to know, okay, it might be because of something called PMS. Even girls, sometimes we don't have explanation for our behaviors. We are having really bad mood swings, as we say, and we have read somewhere that it is because of PMS. But then what is this PMS? So in this video I'm going to tell you what is PMS. Okay, we are going to know the basic things about it, we are going to know the risk factors, we are going to know your symptoms and how you can deal with the situation. So we are going to know this all. So what is this PMS? Well, PMS is premenstrual syndrome, where you have various symptoms occurring in your body, especially during, between your ovulation and menstruation phase. Okay, ovulation as in when egg is released in your body, it is generally on the 14th day, and your menstruation, when you start bleeding, you start to have your menses. Between these days, you tend to have a lot of mood swings, you tend to get irritable. So that is when your PMS is happening, that phase is there. Okay, and this is a very common condition, like 3 out of 4 women are having PMS. Okay, they might be suffering from PMS and they might have like mild, moderate, and in some cases even severe symptoms. Okay, it tends to happen actually because of some hormonal changes in your body during the end of your cycle, when you're approaching your bleeding phase, that is your menstruation. Just a few days before that, progesterone level in your body increases and it might be associated with mood swings. So actually that happens just a few days before your periods, like a week or 10 days before your periods, and it ends once your menses get started. So you don't need to do anything significant about it, but if your symptoms are severe, then we'll see what you have to do. Okay, so firstly, what are your symptoms? So you might have some abdominal bloating, you might be anxious, you might be depressed, you might be having a lot of mood swings, you're getting irritated, you might have food cravings, breast tenderness as well. So you might have these various symptoms. Okay, what are the risk factors? Why, which people are more prone to this condition? The people who are into substance abuse or into smoking, obviously they are prone to it. And again, if you have a family history of abuse, or if you are a patient of depression or bipolar or some mood disorders, then you are prone to this condition as well. Okay, so what do you need to do about it? Okay, so basically if you have mild and moderate symptoms, then it tends to resolve on its own. Like when you get your menses, it will resolve on its own. But sometimes you might have even severe of the symptoms, that so severe that it's interfering with your day-to-day activities. So in that case, you need to see a doctor. Of course, there are a few things that you can do on your PMS days that will resolve, your issues to some extent. Obviously, you can bring some dietary modifications like eat healthy, try to consume more nuts, dry fruits, walnuts. You can also exercise or hit the gym, which will release endorphins in your body and you will feel much better. There's one more thing that you can do, and that is meditation. Of course, it will help you get some emotional stability and your mood swings will become lower than what you have. So I hope these things will help you, and I hope this video was helpful for you. If you guys have any queries or any questions, you can DM me on my Instagram. Plus, if you want me to make video on some specific topic, that also you can DM me on my Instagram. I'll mention the link in description. And thank you so much and see you all next time. Bye bye.